Hey guys, my name is David Netting, and today I want to show you how to get rid of that nagging foot pain. So plantar fasciitis, it's a very common chronic injury. About 100 million people go to the doctor or hospital every single year to get this treated, but we're often treating it the wrong way. We're going more to the symptom rather than the cause. And I've been a sufferer for over 5 years. I want to show you what I've been able to do to get it healed, and it's working on the foot. It's doing a lot of things around the foot. I want to show you a study that I came across and then be able to help you in this area. If you are able to click that like button, that helps a lot. It helps the algorithm, gets it sent to more people. Even click the subscribe button, click the bell icon and all. That'll send you the weekly notifications. And I will be back next week to help you with another injury area. Thank you, and let's get started.
A study in the Journal of Foot and Ankle Research by Jacobs, Ridge, and Johnson, titled Passive Hallux Adduction Decreases Lateral Plantar Artery Blood Flow, a preliminary study of the potential influence of narrow toes box shoes. In other words, when shoes compress the big toe inward, does the blood flow to the foot decrease? Do you ever wonder why the foot pain keeps coming back? The article pointed out, given the importance of blood flow in tissue healing, blood flow may help explain the 46% reoccurrence rate of plantar fasciitis. The study took 45 healthy volunteers who were free of lower extremity injury or pain for 3 months. The first 60 seconds, their foot was at rest, followed by 60 seconds of passive hallux adduction. Here is a picture of passive hallux adduction. The next image is what we would want the big toe to do. After a 5-minute rest, the lateral plantar artery was then imaged transversely for 30 seconds during sustained passive hallux adduction. There was a 22.2% decrease in overall blood flow. Their findings showed that passive hallux adduction, think of the narrow toe box with most shoes, has been shown to have a negative effect on blood flow within the foot. Dr. Aaron Horschig of Squat University pointed out in 2003 a study by Dr. Harvey Lamont in which he performed biopsy studies of 50 patients showed that there were 0 signs of inflammation and that there was dead or degrading tissue. This means most treatments are focusing on the symptoms rather than the cause of the pain. One of the exercises he suggested was a big toe lateral stretch to try to pull and resist leveraging your big toe. Kind of think of going back and forth with it from the big toe. Let's get back to some of the other exercises and how to cure it for good.
Okay, hopefully that made sense. So I want to show you a little bit on the abductor hallucis. So think of from the foot. So I'm going to have some supplies of shoes I'll show you here in a second. But when my foot is constantly in this pulled up position, so kind of think of with a normal traditional shoe. Think of that. Bigger on the heel, but it pulls the toe box, just like that. So when I get that pull up in this area, that's shutting off that nerve supply, as well as when I get that big toe kind of pushed in. There, that medial nerve supply is now being shut down a little bit more than what we want. Well, imagine wearing this kind of shoe all day long, and that's what I'd been doing for about 5 years, mixing in other different ones, but it's causing a lot of the problems. Well, then at nighttime, what I started doing is being able to mix in, and I'll show you what shoe to be able to look at getting. At nighttime, what I started doing was doing some different toe and foot work. It's really simple, but kind of think of taking your foot, and then all I want you to do is take that big toe down and out. See that? Down and out, and you want to pull these other 4 toes up. Just hold it, and you're going to feel that nice, good stretch. Then reverse it. Now think of the big toe pulling up and out, and then we're still trying to get that big toe to pull out, and then pulling those other 4 toes down. Another thing you could do is kind of create a glove. If you take the bottom of your foot, it's going to be a little hard when you're not used to this, but stick those fingers in through the toes, just like that. Now support it and just kind of hold it. Then from there, I can get a little bit of the pulling from the toe. I can start creating some mobility, getting some movement around that foot joint, kind of loosen up around in through those areas. Another tight spot. So when you're landing, we get what's called overpronation. So when you land, the foot, kind of think of this being your foot, we're pressing in. That area is being that bow and string, kind of like that. It's pushing in that area. So we get some tightness pulling up through here because of that rotation. This tibialis anterior muscle is a culprit as well. You could work on strengthening it, doing what's called toe flips, where all you do is just kind of lift the toes, what's called dorsiflexion. But to loosen it up, this one's kind of a big key. That muscle, along with what's called the peroneus longus on the outside part of the calf, dig in there. It's right below the kneecap on the outside. You're gonna feel that muscle. For me, that has felt tender. So what I do is I just kind of dig in there and I start to massage and start to loosen that up. So I'm working on the foot things, and then I'm getting into this area. This type of shoe compared to here, so kind of think of looking at the difference there on that one. Bigger heel box, lifts the toes up. Now this was one, it's called a minimalist shoe or a ground zero shoe. You don't want to wear it all day the first day or two. You want to just kind of slowly start breaking it in and be able to maybe wear it for 2 or 3 hours, just kind of getting used to it. Then take them off, go back to your normal traditional shoes till you can start getting used to it. Your feet are not active. They're not used to using a shoe like this. It's gonna make a big difference. If you look at, from this as being from the traditional big heel type shoe, look down here. This one is the insole, so it doesn't allow a lot of foot spread. Now, I'm in these shoes working as a trainer all day long. So that's putting a lot of pressure to pull that big toe in, that big metatarsal, tightening and squeezing the abductor hallucis, and then cutting off that nerve supply. If you, through this summer, picking something that has a little bit wider toe box, something even just with a little bit of a ridge, these are flip-flops that now allow a little bit more spacing. And so that's gonna be something that'll help. Anytime if you're feeling like it's hurting, it's flaring up, it's stressing, avoid running, avoid long hikes, avoid high heels. I know some of those different things, well, but those are the things I enjoy doing or enjoy wearing. Those are the things that are gonna cause more of the problems. So work on some of the solutions. And what we're doing is we're working on the cause of it, not the symptom. A lot of times with plantar fasciitis, I've been going always to the symptom. Since I've been working a lot on my foot, getting that toe to kind of really pull out, even wearing what's called toe spacers. They look kind of funny. You could order them on Amazon. They're very cheap, but just do toe spacers. It kind of looks like a woman that's getting her toenails done, getting a manicure or a pedicure. Sorry, see, I don't know because I don't get those done, obviously. But you put those here at the bottom and then just allow your feet to spread out just a little bit. Kind of creates a nice natural spread there through it. Those are a few different things, as well as wearing a plantar fasciitis boot at nighttime. But if you can start working through some of those things, hopefully that can start helping. Looking at the research, looking at everything that I've studied in over 5+ years of working through this foot pain, this is what's helped me to heal it. I'll see you again next week. Please click that subscribe button and like, and I'll see you then.